How do medical providers know when they are making the right decision in the face of vast uncertainty? We're in module 3, part 2, just so you know you're in the right place. So how do medical providers know when they are making the right decision in the face of vast uncertainty? I have no idea how you do that. This is a question that frequently comes up for providers of trans medicine and others working in new or not well understood areas of medicine. Hey, COVID. Oh, not me. No, I don't have COVID, but that must be what it's like when you don't know what the hell you have. Along with the uncertainty stemming from the novelty of trans medicine, many providers shared because this person wrote this book, Steph Schuster interviewed trans medical providers with little to massive experience. Many providers shared that they had never met a trans person until they walked into an exam room and were startled to realize that the person before them was trans. That would be harrowing, especially for me if you were looking at me. Holy crap. For most of their careers, up until that first encounter with a trans person, many of the providers I interviewed felt assured they had some capacity to work with all of their patients. However, becoming involved in trans medicine brought into sharp relief the inadequate training, clinical experience, and scientific evidence that providers repeatedly described as wanting so they could work more comfortably with this population. Melissa, a gynecologist a decade into her career, shared the following story about the first trans patient. I had done some homework prepping for the visit because I knew she was coming. We took blood labs. I did history and everything. I was going off of WPATH standards. So WPATH, which I will try to insert into the video right here. I'm actually just, I know what it is, but WPATH is the body of international standards, the World Professional Association for Transgender Health. So they create standards across the world. And I'm going to tell you something about WPATH. I still felt kind of weird, like when I first started practicing and that imposter syndrome stuff. Like this is something I really hadn't been trained to do, Lisa kept saying. But also these are meds I work with all the time. Like so many providers who began working in trans med with little familiarity about the patient group, Lisa did her due diligence preparing for the visit. Going through typical routines of taking patient history and running blood labs, she tried to approach the patient exam as nothing out of the ordinary. But there was something, as she later described, that she wasn't doing right. She looked to clinical guidance from WPATH for guiding her through the hormone initiation and followed them precisely. But still, in the end, she felt she was learning on the fly and totally stumbling through it. As providers work their way toward clarity as they experience uncertainty, there are multiple strategies they can turn to, such as guidelines. But why might medical providers feel such uncertainty when they work within medical uncertainty all the other time? These are really great chapters to work with. And you might not need to dig deep in this book. It might just validate you. And that's why I chose it. I wanted you to feel a little bit validated, like, I have no idea what I'm doing. You know what? Me either. The thing about WPATH guidelines, and I will put the zine up, is that I saw that the WPATH guidelines for taking testosterone were 0.5. And so let's see how many of you follow along what I'm about to say. And so I had started with a gel. And if you don't know, you can take testosterone. You know about testosterones in a gel and you put it behind your arms. And I lived in a Massachusetts farmhouse and it was very poorly insulated. And my landlord gave this many fucks about it. And I decided that it was too freaking cold to walk around without my shirt on while the testosterone dried, right? And you don't want to rub it off and put it on your clothes. And so I moved to the shot. And also, I just sometimes didn't want to get a shower because it's so cold. And then I was like, should I just put it on? And also, I started during the pandemic. So many people, so many trans people started transitioning in that time and space of really getting to be with themselves and being like, oh, I cannot be with myself. And not feel that way in my body. Someone had said this to me. I wasn't clever enough to come out with it, but I started testosterone because I wanted to see if I felt more like myself. I remember someone saying that, and I was like, oh, yeah, I want to know that. And I remember saying it to my doctor in Kentucky. She said, oh, that's brilliant. I said, I didn't come up with it at all. But but it felt right, really rang true. Anyway, so I'm doing the shot, and you can only put minimum of 0.1 in the shot, right? And you're like, milliliters over, don't know. Anyway, so the doctor in Kentucky, I'm in Massachusetts, says, do you know how to do this? I was like, of course, because I have enough trans friends to teach me. She's like, most trans people, like other trans people, teach it. Absolutely. So I'm on Zoom with my friends, um, Sunny and Sam, who are also one of Sam, very famous trans poet, and I put it in and I get out the bubble, even though it's going in the muscles. So I put it in and I start doing it. And over time, very, very slowly, very, very gently, like over a year, I very gently increase. And I get up to about 0.35 and then 0.42. I don't know. I'm trying to get to 0.5 because the WPATH says that the standard dose is 0.5. And I mentioned that to a trans friend, and I've always been awkward, feeling weird talking about this with a friend, and a friend says, you know that they don't actually know, right? And I know better because there is no long-term body of research, right? Except for the Netherlands, where they sterilized us. Here I'm using my Wii. But there was forced sterilization. So we have decades and decades of data, so you don't know what happens with your ovaries. Um, and we can get to mine another day. Cysts now, gosh, is that we don't know. What data? What data, my friends? Anyway, point being, we're going back to testosterone and my dose. And I was, started crying more. And you're like, oh, turned into estrogen. Somebody in there is going, someone's following my dose number, being like, Jack, no. Because I had gotten 200 milligrams per whatever in the tiny vial. I know I'm speaking medical stuff, you understand. And I would say that I know more than most of my friends. No, half. I would be in the middle, right? Maybe just. Um, there's people who know so much more than me, who can speak fluent science. It reminds me of having to understand everything about HIV/AIDS during ACT UP because there's no one there to teach you. Anyway, this young trans person, Rennie Yehuda, created a zine, and he interviewed hundreds and hundreds of people, wrote in about their experience with testosterone. And it was only in using that zine, reading that zine, that my girlfriend had pointed me to on the Instagram, that a 20-something put together, that I found out that I was taking twice as much as I thought I was in the syringe. So when I thought I was getting up to 0.38, I was at 76. So way over what the dose was. And no wonder I was crying. And yeah, because you too much testosterone becomes estrogen in your system. And I'm sharing that story with you because there's this uncertainty about what we do and don't know. And we're afraid to ask. Um, my doctor just presumed I knew everything. When I went to my next doctor, who's around here, who read 4 pages of details of what happens to me on testosterone. You will see colors brighter for a little. You might see colors brighter. Your voice, like in detail. And I was like, I do know all these things. Those things I knew, but I might not have. And I was like agonized sitting there listening to the list. But I didn't know about science. I don't know that scientific element of it, right? And we're all figuring this out. Um, I don't think there are many trans people over the age of 25, 27, and maybe that's when you start to settle in Saturn return and all, that you start to say, wow, we're just figuring this out together. And I think it's improving. Um, I want to say what you need to do is to sit with this book, or to sit with this book and read a chapter or two. Just learn something new about your industry, your field, about what other people are experiencing. This is great. If you want to know, this book is absolutely brilliant. It's in the end, academic books do not go into multiple printings, my friends. But this is really rigorously, brilliantly taking apart the idea of how we constructed trans identities through transgender children, and how we got to a point now where how transness was celebrated and liberated to protect children, right? Specifically white children, and how that's actually a backlash of this, of the so-called parents' rights movement. So sit with this, read a couple chapters, think about your medical practice, think about what you want for trans people, think about what you want for yourself, think about what you would like, think about if it's your kid or your sister or whatever, or your best friend, might be those people, might be you. Yeah, think about your forms, the signs, the pictures of people on the wall, the images of gear on the wall. You know, the last story I think I will tell is the number of times I still, when I go, only when I go to the doctor do I check the F box for female. And I love when it says, how would you like to identify? And the number of times, and this has changed, and it definitely happened a lot more in some place like the US South and Kentucky, but it also happened in Massachusetts. It was very liberal longer ago. It hasn't happened recently. People say, oh, I'll update your gender. And somebody actually changed my gender without asking me, thinking, oh my God, how embarrassing. We didn't fix this. It should be male. But what happens if I'm listed as male and you don't know I was assigned female at birth? Like what tests, what, like how blood work comes back, or like thinking about any of that. You know, there's really, we really don't know yet, right? Um, and each of those people was so horrified and um, embarrassed, and I just thought was very sweet that they cared. Okay, we're stopping. I'm hammering. We gotta stop.